people don't usually they're kind of very reserved about treating an acute attack, right? They won't throw
Mhm.
everything they have at it. So I'm not sure what the best way to go about discussing that is,
Yeah.
but
Yeah, I think when somebody has the onset of a cyclic vomiting syndrome episode, or they expect to, they can feel it coming on or expect it because of their environment and things that are going on. Early treatment's important. So early recognition of what's going on with your body, listening to your body, and then instituting that first step of like an action plan or treatment early is really important and might prevent those ER visits, might get you back to school or work faster. And so I think early treatment and recognition, and then knowing what you're supposed to do and having it with you. So whether it's NSAIDs like ibuprofen, whether it's Zofran, whether it's a dark, quiet room and laying down to try to take a nap, all of these things work for some people. But whatever the plan is, you want to know that you can implement it right away. So for instance, if ibuprofen and Zofran are part of your plan, but you don't have either of those medicines at home, or you're away at college and you have them at home, but you don't have them in your dorm room, you're not going to be able to institute it. There's going to be a barrier there. And so knowing what your plan is, being able to institute it right away, and then after that, how well did it work? Do I need to adjust this plan? Because I think people are given a plan, whether it's from guidelines or from their doctor, said, do this when you get an episode that starts. Well, if it works, great, awesome, that's your plan. But if it doesn't, you should tweak it for the next time until you find something that really does work.
100%, because that's what gets us to the point where we can abort the episodes,
Right.
right? That's a really good point. Do you talk with about pre-treating with your patients?
I do. I think sometimes it's really hard to know how far in advance to pre-treat. So, for instance, I wouldn't pre-treat just because finals is coming up. But if somebody has a predictable exacerbating factor and they know I'm going to Boy Scout camp out this weekend, and every time I go there, I sleep less, I'm more active, and I have an episode when I get home. Okay, so you probably should take something to try to prevent that because you still want to be a Boy Scout if that's, what you want to do. And so taking medicine in that way, on the drive home, take your ibuprofen, take your Zofran. Something like that, I think is very reasonable.